most common call I get that involves medical malpractice is about plastic surgery or cosmetic surgery. And it's always, I don't want to say always, but 99% of the time, it's someone who's just upset with the result. They expected one thing, they got another. They thought their breasts were going to come out one way, and they were going to look like Pamela Anderson, I don't know. And they were unhappy, and they think that that's medical malpractice, when it's really not. So when somebody comes to you from day one and they want, something done, how do you deal with that, satisfying that expectation or figuring out what it is?
Communication is the most important thing. You have to be on the same page with the patient. You have to understand the patient. The more people that you have, I have a body of knowledge.
Right.
A patient walks in with very little bit of knowledge concerning a procedure. They have a very layman's kind of knowledge about this particular procedure. And what I mean by layman's is they see the best results on TV. They see the actors, the actresses.
The magazines.
Magazines. And they don't understand that these people have personal trainers 6-7 hours a day. They make a living out of doing this and looking good. And a lot of people who I see do not have that opportunity to work out 6 hours a day. I mean, that's not their prerogative in life to make money by looking good. They just want to feel. They want to look the way they feel. And most of the time, the magazines, the TV shows, all the celebrities, it kind of pushes people to the side of unrealistic expectations. And you have to match their expectations with what they're presenting you with.
How do you know what their expectations are? Do they usually just pull out a picture and say, I want to look like this?
Sometimes they do. Most of the time, it's communicating with the patient. The more time you spend with the patient prior to the actual procedure, the better up you are to understanding what their needs are, what they want to achieve. And a lot of the time, it's just educating patients.
What about if it's a woman who's married? Do you get the spouse involved? Do you bring her husband in?
Absolutely. Absolutely.
Do you want to know why? I mean, I know you can't really ask, but are you looking at whether they're trying to cure something, maybe a relationship problem, or make the marriage stronger? Maybe age is taking its toll. Maybe either one is thinking that if somebody becomes a little more voluptuous, it might help the marriage?
Well, a lot of times we see patients who come in who I would, from a medical standpoint, do not have a difficulty aesthetically or cosmetically. They just have an unrealistic expectation.
Yeah, it's a big word, expectation.
Yeah, well, it's what I see, the body of knowledge that I have, and what we can achieve as compared to what the patient believes can be achieved. And so what you have to do is impart that knowledge and tell them about the procedure, what can be done, how it can be corrected if something needs to be corrected. And once you provide them with the knowledge, from soup to nuts, everything that if they came in with a problem, let's say breast, and you give them the least invasive, least costing, least lasting procedure, all the way up to the most invasive, most costing, longest lasting procedure, and you give them the knowledge in between there, and then they make the decision as to what they want. To address your second question, your question about people coming in and involving spouses, yeah, I would say that it's basically demographics. If you're in an area where, like Miami Beach, where there's a lot of young people, you'll have a lot of people coming in and wanting to have a procedure performed for what I would consider the wrong reasons. And you really need to talk to these people. I mean, you need to find out what their motivation is.
I mean, what do you find here in Staten Island?
I find that typically it's a young mom, 2 or 3 children, doesn't want any more children, and just wants to, the pregnancy has caused some difficulty with the body, and they want to just dip and tuck here and there. That's a majority of my patients. Then we have the baby boomers who are very active, and with the increases in health awareness are very healthy, and they don't feel, they don't look the way they feel when they look in the mirror.
Look in the mirror.